Viewers are from here. We head straight on over to our final interview segment this morning with Ayanna Sebro, and she's the Technical Director of the National AIDS Coordinating Committee. Good morning to you and welcome.
Hi, good morning. Thank you for having me.
All right. So as we get the conversation started this morning, we're speaking about the upcoming Stakeholder Consultation. So tell us a little bit about this.
So, good morning again. So I represent the National AIDS Coordinating Committee Secretariat in Trinidad. And so we are coming to Tobago and we're having a virtual stakeholder consultation this Friday from 8:30 to 1. And what we're doing is we're trying to develop the new National Strategic Plan for HIV for 2023 to 2028. And we really want to get the perspective of Tobago. What does Tobago want to see in the new National Strategic Plan? How does Tobago want to go forward in terms of how they design for the HIV/AIDS responses and what is felt and what is experienced by clients in Tobago?
That this is taking place in collaboration with the Division of Health, Wellness and Social Protection. Tell us a little bit about the target audience, those persons that you may be targeting to really have an input here at this consultation.
So we would want to target members from the faith-based community, from community programs, people from the village councils, people who might have been touched by HIV in their lives, or know someone who may have experienced HIV, or someone who may have a sense of, for example, the gender issues, the vulnerability issues, the disaster issues. Stakeholders from the Division of Health and Wellness and Social Protection, from the Youth Education Division, persons involved with supporting people at community level. So this is kind of where we want to target we want to get those areas to give us a varied perspective, because with the new plan we're looking at multiple areas. We're looking at combination prevention, how we experience prevention for HIV, which includes all the issues around testing and education, community support, community development, how we look at prevention, treatment and care, how people experience treatment, what we do in terms of data management, what we do in terms of gender equality, how we manage our data, and how we involve the community going forward.
How would you
so we really do need a wide group.
Yes. How would you speak to those that ask the very obvious question? We are looking at the National Strategic Plan for 2023 to 2028. What can we say would have been the successes of prior efforts in terms of the strategic direction? Because certainly the National AIDS Coordinating Committee is not a new entity. So tell us a little bit about past achievements and successes looking at a similar kind of strategic direction.
So in terms of the outgoing National Strategic Plan that was developed previously, some of the successes of the previous strategic plan include the significant reduction in terms of the incidence, the reduction in terms of AIDS-related death that we've experienced between 2010 to now. Trinidad and Tobago is certainly not where it was when we first started this epidemic. We have machines in country that can check to see the strength of people's immune system and check to see the level of disease control. We have virtually eliminated mother-to-child transmission, so that for the women with HIV who are found to be positive and pregnant, their babies do not have to be born with HIV. The medication that we do have for persons to be treated is free of charge. For people to be able to access medication, people can walk into several health centers across the country and access a free HIV test. So these are things that have taken us forward. When we first started treating HIV, we didn't have as much medication as we have at this time. Our prevalence is about 1% at this time. And in terms of the country where we are with our 95, we have achieved the first target. We are at about 63% in the second target, and in the third target, we are over 9%. We have a ways to go, yes. These targets are definitely not a fixed. They are dynamic because it engages people, and things that happen with around people will shift from year to year. But we have made some successes. And if we come together to plan what we do over the next 5 to 10 years, I'm sure that we would be able to achieve some of the targets that we have for ourselves in terms of the elimination of AIDS as we know it.
Would you say that we have seriously seen a fundamental change in the attitudes of individuals towards persons living with HIV and AIDS now? After so much time, and there was a point where serious stigma, would have been attached and concerns related to discrimination. Where would you say we are at now in terms of those efforts?
Um, if I were to gauge that on a scale of 1 to 10, 10 being the best place that we could be, and 1 being where we might have started at, I would say maybe we would be at a 6. There has been some significant inroads where persons living with HIV are supported by their families. Persons living, if a child is born with HIV, they stay with their families. We don't have as much abandonment. We still do have some stigma and discrimination issues for some members of the community, and some members of, for example, the LGBT community might experience certain amounts of discrimination. And there are still some people who might turn their back on their families, unfortunately. Experience some amount of stigma where people think that it's okay to be able to share people's personal health information. And that is one of the big things affecting how people are presenting to test, sustaining and presenting for treatment, as well as viral load suppression. So we have moved, but we really need to take a serious stock and look at stigma in terms of how stigma is affecting us from achieving our goals.
All right, excellent. And just as a reminder to persons, the registration process for participation in the upcoming consultation.
So what would happen is, so that the Division of Health, Wellness and Social Protection is going to send out a flyer. I will also ask for this flyer to be made available on the social platforms of the NACC for stakeholders from Tobago to be able to access it. We will put that up today. But you can click on the link that will be provided. You can register, and we will send you the login information. In addition to that, we will send you some of the documents to guide, to give you a sense of where we are at this particular point in time, because we have been engaging and having discussions about the strategic plan. For persons in Tobago, I want you to know that we are coming back again because we also have to discuss the national HIV policy. I encourage you to look and visit nacc.gov.tt if you want to see what the old strategic plan looked like, if you want to get a sense of what the new policy is looking like, because we have to do consultations so we can finalize these 2 documents so that we know how to attempt to resource them, so we can get to where we want to be in 2030, because we want to end AIDS in Trinidad and Tobago by 2030.
All right. Thank you very much there, Technical Director Ayanna Sebro of the National AIDS Coordinating Committee. And this is a clarion call and a reminder that the National AIDS Coordinating Committee, in collaboration with the Division of Health, Wellness and Social Protection, will be hosting a virtual stakeholder consultation looking at the new strategic plan, the National Strategic Plan for HIV 2023 to 2028, and that will be taking place on Friday the 14th of July 2023 from 8:30 a.m. to 1 p.m. So we look forward to, she has just, of course, highlighted for us, stakeholders far and wide are welcome to have your input. And I think it's safe to say that this information will also be available on the relevant social media pages, etc., for you to have access and to click and to use the link in terms of ensuring that you register to participate. So once again, we want to thank the National AIDS Coordinating Committee Technical Advisor Ayanna Sebro for joining us here this morning. All right, viewers, we say thank you to you as we bring to an end this morning today the Tobago Updates morning show. Certainly, it's been a very interesting morning, bringing you a number of perspectives, varying issues in the discussion. And we look forward to tomorrow. Tomorrow, we're wrapping it up here for now. But remember to stay tuned and stay connected, because we head on into Tobago in Focus, and that's a correction, Tobago Notes. We're heading straight on into Tobago Notes, and this will be followed by GMT. Take care and bye for now, folks.